Hello, the course today is going to talk about fall prevention. And this presentation is made by Department of Nursing and is also Center of Quality Management in the National Taiwan University Hospital. We'll first talk about the care issues. So the first point we want to know is that fall events are preventable. So we want to know about the causes first, so that could be due to the patients, the environment, equipments, medications, and caregiver factors. And among these, caregiver factor is very, very important. It's about 20% of all the reasons. And why do we want to prevent fall? The most important issue is that because complications may happen after the fall. So some kind of injury from the skin, the bone, and decreased activities, there's some complications, prolonged hospital stay, and also medical costs will increase after the fall. So that's why we want to prevent them. So we have to make sure that all the medical staff, the patients, and the caregivers all have the ability to care as a very good way to prevent fall. The harm that can cause during the fall are a couple of them. So the first one here is talking about fracture. So the bone fracture is a very critical and important issue. Sometimes can cause a very big injury and great pain to the patient. The second one is head trauma. Head trauma causing intracranial bleeding may even cause death. So that is a very dangerous thing. So we want to avoid as much as possible. The third one is because of the fall, the patient will be afraid. So sometimes activity will be restricted and is afraid to do more activities around. And the fourth one is the daily life function will decline. And the fifth one is the fear of falling again. So that may cause the patient not to move around and exercise as they need. When is the most frequent time of fall? We want to know this, and then when we are carrying that patient at that certain time, we want to make sure that everything can do our best to prevent fall. So the first one, which is the most common one, is the middle of the night or early in the morning when getting up. These parts are the most critical issue and the most critical time when fall may happen. The second one is when moving around with different activities. So like getting on and off the bed, walking or toileting, and these doing these kind of activities may have a higher risk of fall. The third one is about location. So the bedside, the bathroom, or the hallway, or all different places that when the patient is alone, they may fall down. And next we're going to talk about the most common factors that can predict the patient may fall. So these are the high-risk moments and factors that will cause the patient to fall down. The first one is past history with fall events. So if the patient had fallen before, there's a higher risk and incidence of falling again. The second one is the age is older or equal to 65 years old. The third one is the consciousness has a change. So recently the cognition, or there's confusion, agitation, seizures, and different kinds of issues about the conscious, that will cause the patient to have a higher risk for falling down. The fourth one is about mobility. So if the mobility activity functions are deteriorating, are getting bad, then there will sometimes maybe like physical weakness, dizziness, or vertigos, or sometimes posture hypotension. These things may cause a patient more easily to fall down. The fifth one is about medication. Some antihypertension medications, which will cause hypotension, some hypnotics, narcotic analgesics, anti-epileptic agents, and psychotropic medication. These all different kinds of medications make the patient at a higher risk for fall. The sixth one is about the environment and equipment. So a slippery floor, the walkway has obstructions which will make the patient hard to move around. The lighting is not enough, and there's some improper restraint, and so the patient can move partially but not very safe. And also using the assisting device not adequately, or using the wrong one, or the equipment has any failure, or the shoe has any problems, these may all cause the patient to fall down. So we need to identify the high risk of falling. So we have a tumbler project. So you can see over here, if you see this sign of a tumbler here, it means that we have to be very careful of the patient's condition, and especially we have to notify the fall prevention program, which is very important. We also have some instruction sheets that will talk about fall prevention. And we also have a signature sign over the hand wrist. And if you see that tumbler sign, then you know that this patient has a higher risk of fall. We have to be very careful. Next, we're going to talk about when we're lying down on the bed. So when we're lying down on the bed, we want the whole bed height to be lower as possible. So because we want to keep it lower, so if there's a fall, it won't be very severe. And especially when the patient is agitated or has some confusion, you have to make sure that every time the handrail around both sides of the bed has to be pulled up, and we have to give protection constriction to the patient to make sure that the patient doesn't accidentally hurt himself or fall down from the bed. And we have to make sure during the constraint, the skin has no injury and keep the integrity very good. The second part is the important part, which we are going to get off the bed. So if we're going to get out of the bed, we have to make sure the environment is safe. So the walkways, the toilets all have enough life. The walkway is very clear and dry, no objects obstructing the way. And if there has any problems or slippery on the floor, we need to tell the staff to take care about it. For the equipment preparation, we have to choose the appropriate assisting device, so such as walkers, wheelchairs, crutches. These are all very important. And we have to assess whether this patient, when he's moving around, whether they need other people's assistance. If they do, then we have to make sure before they move, they have somebody to assist the patient to move around. And for the patient-owned preparation, the shoes have to be appropriate, not slippery, and the clothing has to be appropriate, will not be trimmed or fall down because of the clothing. And we have to make sure that sometimes the medical staff request the patient not to get off the bed. If that is an order, and then we have to make sure that the patient doesn't get out of the bed. If there's any question or problems, we can talk to the medical staff. Next, we're going to talk about ambulation, where we're getting off the bed and we're ambulating across in the ward or bedside. We have to make sure that the first thing when getting off the bed, the posture change has to be very slowly and progressively. Make sure the patient does not have dizziness, does not have posture hypotension. So when the patient is sitting up, let him do it slowly. Maybe sit down at the edge of the bed for 1 or 3 minutes to make sure there's no discomfort, no dizziness, and then slowly stand up very slowly and make sure that everything's safe. And there's enough time to avoid dizziness. And then after standing up, we will provide the assisting devices, whether it's walkers or crutches or wheelchairs, or sometimes they use a potty chair for using a toilet, and that was also fine, but we need the assistant and to make sure that is done safely. And we have to make sure that when the patient is getting off the bed, there's no pressure push on unstable things, such as like the top table on the bed. Usually that is only slightly attached to the bed. So if you push it very hardly, it will flip over and become very dangerous. So do not push any force or pressure on the table board on the bed. And when you're using mobile devices or wheelchairs, every time if you're not going to move it, make sure you lock the brake and to keep it steady and very stable when we're changing the positions. And the caregiver has to be very careful that we don't let the patient be alone. and that will be a very dangerous time when the patient maybe fall down. We're going to the toilet. That is also a very critical time and critical point. So we have to make sure that the patient doesn't go themselves. If the patient is a high-risk patient, they don't go to the toilet themselves. Make sure before you're going into the toilet floor is dry, not slippery, has nothing dangerous in the hallway. If anytime you need assistance, remember there's always a emergency call bell that you can call for the nurses or the medical staff for assistance and helping. When we're going to leave the patient away and do something else, we have to first make sure that whether the patient needs to go to the toilet, because sometimes there's an urgency for that. So if the patient needs to go to the toilet, we go there first, and then we go away to do our things. So when we're leaving the patient, the second thing we want to make sure is the handrails has to be pulled up. So the safety rails has to be in a steady way. It's not moving and everything's fine. And the patient, when he's lying down on the bed, they make sure that he or she can get the call bell within a very easily accessible position. So it's very easy for them to get the call bell and push the button. And sometimes the patient just needs something very handy or beside them, so like glasses, sometimes their bedpans or urinal or some little things. You can need to put it just beside the patient for them to easily get it without getting off the bed. And we also have to remind the patient again, do not get off the bed by their own. And if they have any needs or any issues, they can inform the nurse and use the call bell anytime they need. At the night time, this is also a very critical time when the patient may fall down. So we have to make sure there's night lights in the bedside, and to make sure that if the patient wants to see anything or do anything, the light is enough clear and the lighting is good enough for seeing around. And we have to tell the patient that getting out of the bed and going to the toilet alone is very dangerous at night time. So before going to sleep, we encourage the patient that they should go to the toilet first and or use the bedpan anytime they want, by a bedside chair, and make sure that they don't need to go to the toilet. If they want to or need to go to the toilet, then call the caregiver or even the medical staff if they need that. And the caregiver's bed should be next to the patient's bed, and with both sides of the handrails pulling up and in a secure way is very important. And so the caregiver and the patient needs to have a good communication. So if the patient wants to call the caregiver, how can they call them? And use what kind of way? And if the caregiver wants to wake up the patient, how they should do it. So that would be a more acceptable way and more easy way for them to let each other know how they want to be wake up. For children, there is something a little bit different, and we have to notify, besides the general rules, also at the same with the adult patients, children also have some very important things that have to be notified. The first thing is to keep the children in the caregiver's eyesight. So everywhere, no matter where the children goes, you have to make sure that you see the children and there's no danger around the place. So anytime you need to pull up the handrail to make sure that the children doesn't fall down from the bed and prevent them fall, especially when the caregivers were going to turn around to do maybe get a diaper, maybe deal with the milk, or go to the toilet or other actions. We have to make sure that the children is safe on their location. So every time when the children is on the bed, we have to make sure the handrails are all pulled up and safety guarded on the bed. And especially we have to make sure that when the children, sometimes they want to stand up on the bed or even jumping on the bed, that is very dangerous. And to make sure that all the security and the handrails are put it on a very safety part. Otherwise, jumping or running around or standing up on the bed will make the children easy to fall down. That is a very dangerous way, and we have to all be very careful about that. And especially when the children is playing around, they're maybe sometimes running or playing on the bed. These all have to be very carefully observed and take special attention that the children doesn't do any dangerous motions or activities by themselves. And also they sometimes have IV stands or the infusion stand and the IV tubings. These parts, when they're moving around, has to be very careful. We don't want the tubing to be dislodged, slipped. Otherwise, we don't want to be tripped by the tubing. Sometimes it will cause the children to fall down. That would be very dangerous. And the fifth issue about the children, when we're moving around, we would suggest to use the baby cart or the wheelchair when the children cannot really walk very stably themselves. Do not hold the baby with one hand and use the IV stand in another hand, which sometimes, if we fall down, the baby will get hurt. And that is very dangerous, especially when the infusion stand is very hard to push around. So sometimes the balance when adults are walking will be affected and maybe will fall down. So that has to be very careful. The sixth one is also about climbing and jumping on the bed or the sofa chair or the cabinets or the window sills or higher places. We all have to be very careful. Children they love to play, but we want them to play safely. The seventh one is do not let the children running back and forth on the corridor, because sometimes there's cars and tracks, or sometimes there are wheelchairs going on the way or some on the corridor, which running around is very dangerous and maybe will hit something accidentally. The eighth one is also the same as with adults. So we want to keep the bed, both sides of the bed rails also keep up every time. And we want to, if the bed is just beside the wall, we want to keep it attached to the wall, so one part will be very safe. And we want the caregiver's bed to be very close to the bed of the children. If we have done all these preventions we have done, but unfortunately the patient still falls again, then we want to make sure that at the immediate time when the patient just falls, we want to let the nursing staff know immediately. And we want to let the family know that this happened, and we also need to very carefully observe the patient or the children to make sure that they have any conscious problems, they have any movement issues or swelling or any pain. All these have to be notified to the nurse and the staff immediately. So we also have a QR code for the course of fall prevention, which you can learn online. So fall prevention needs your help and everybody's help. Thank you.